Cataracts. Now, contrary to popular belief that cataracts can only occur in the elderly, it's not only in the elderly. As stated here, this can develop at any age. So if the patient has risk factors such as exposure to toxins or long-term damage to the eye, for instance, or very poorly controlled diabetes, all of those, we will look at the risk factors. So those are the common risk factors that can develop in cataracts. Cataracts is basically a opacity or cloudiness of the lens. The lens are supposed to be clear. It's like a windshield in front of our eye. The purpose of the lens, of course, is to protect the eye from debris, from trauma. So we need that lens to be clear to enable us to see clearly. So if there's cloudiness there or opacity of that lens, then of course that impairs vision. So this can cause central vision loss. Age is just one risk factor. Manifestations. This develops over time, so the patient's vision gets cloudier and cloudier with each succeeding year as the opacity gets worse. So here are the manifestations. Okay, so the patients will look as if their glasses need cleaning. Okay, so it's like your windshield getting dirtier and dirtier. There is no pain in cataracts. So the patient will have a variety of severity in the cloudiness or in the loss of vision. So they'll have blurry vision, astigmatism, meaning you'll have problems with near or far-sightedness. You have double vision. And of course, the eye will look like this. So the severity again will vary. So it's not going to always be a perfect circle. Sometimes the patient will have different shapes of the opacity. Some will be shaped like Texas. Some will be shaped like Florida, for instance. Okay, different shapes. It's not always a nice circle. Appear white. It's not blue. Again, it's painless. Okay, there's no pain associated with cataracts. Problem again is with vision. Central vision is affected. Will this be a good select all that apply question? Yeah. Okay, your favorite. Management. There are no eye drops. There are no medications to stop cataracts. The only cure is surgery. What's the only cure? Surgery. Okay, surgical removal will cure cataracts. The decision whether or not the patient will have a lens implant will depend on the surgeon. So the ophthalmologist will decide whether or not the patient can benefit with a lens implant. Limitations to surgical options will of course include if the patient has severe hypertension or uncontrolled diabetes, that may prevent them from getting surgery, meaning surgery will be delayed if there's poorly controlled diabetes, for instance, or really high blood pressure, because how will the incision heal? How will the surgery heal if we have those factors? Do you understand? Okay, because describe the circulation in the eye. Is the eye a delicate structure? Okay, so describe the size of the blood vessels that supply the structures in the eye. So those are also as fragile as the eye, correct? Okay. So they're very sensitive. So the surgeon will be very careful before they do surgery. So they will evaluate the patient overall. Another risk factor for cataract is what again? What chronic disease? Diabetes. Okay, so most patients who get cataracts are diabetics. Now, there are going to be eye drops here, but they will be used before and after surgery. okay? But the eye drops is for the surgical procedure. Is that clear? It's not for the cataract. What's the only cure again for cataract? Surgery. However, since the patient had surgery, it's an invasive procedure, will it cause infections?
Yes.
Now, any manipulation of the eye using a scalpel, needles, is that traumatic to the eyeball?
Yes.
Will there be swelling and edema,
Yes.
inflammation? Will you need eye drops to take care of that inflammation and swelling?
Yes.
Okay, so again, the eye drops here, so you will never be rid of the eye drops. Again, the eye drops is not for cataracts itself, but for the post-op or pre-op and post-op purposes. Are we clear? Meaning the patient will be taught how to administer eye drops or eye ointments in the form of antibiotics, anti-inflammatory, or steroid eye drops. Any questions? So it still brings us back to the procedure on how to administer eye drops and eye ointments. Will you be tested on that? Why? Who's teaching the patient how to do eye drops? Okay, so do you need to know that?
Yes.
Okay. So here are the risk factors. Again, age is only one. There are other causes or risk factors for cataracts. You may identify with some of them. Anyone in the family that have cataracts?
Yes.
In your families?
Yes.
Okay, so if that's the case, then you tend to share the same risk factors, right? If you're in the same family, like you have the same high cholesterol, some weight problems, for instance, or diabetes, correct? So you share the same risk factors, so you share the same diseases, all right? Like you say, oh, take after your grandma. Okay, just like grandma, I'm diabetic, just like grandma. So here are, again, risk factors. Are these good? Select all that apply?
Yes.
Okay, very good. Okay, I won't test you on the complications of cataract surgery. We will discuss and test your responsibilities after any eye surgery. Now, even though this chapter only talks about cataract surgery, which is cataractectomy, even if it's another surgical procedure, is it a different eye that they did trauma to? Let's say I perform scleral buckling versus cataract surgery. Is there any difference in the post-op care? What's the difference? Is it a different eye that they did cataract on and another eye that they did scleral buckling on? It's the same eye. So therefore, same eye trauma. So is the post-op care different? Same. Okay, exactly the same. Okay, let's go to the pre and post-op. This is nice to know if you're interested in how they do eye surgery. You can also look them up on YouTube. There are many actual surgical procedures done on the eyeball, but I don't like to show it because I can't stand looking at it. So here we are. So your test questions will be again on what? Pre and post-op care, because you're the ones preparing the patient for surgery. You're also the one receiving the patient after surgery. So you need to know your role. Pre-op wise, the usual orders is you want to teach them about what to expect after surgery, correct? So imagine what will happen if somebody messes with your eye, puts instruments into it, ties it with sutures, and then lifts it up in 16 different directions. How will you feel after that procedure? Okay, a lot of pain, a lot of swelling, and what will the eye look like? Swollen. What color? Very red. Okay, it will appear bloodshot because of all the trauma. So of course there will be microscopic bleeding on the eye, and then will make your sclera look very red. Okay. So you tell the patient that, and then the patient will be given, your responsibility will be giving the pre-op medications. So the doctor will give dilating eye drops. Prescribe dilating eye drops. So who's giving this? Okay, so the nurses are. So again, brings us back to the procedure on eye drop administration or eye ointment administration. So the medications, the eye medication you'll be giving range from antibiotics to steroids to anti-inflammatory eye drops or ointments. Post-op care. Now, where is the eye located? Inside your head. So therefore, is this technically like brain surgery? Yes. Okay, so somebody worked on your inside your skull, correct? Because the eyeball is inside the skull. You agree?
Sure.
All right. So therefore, activities that cause increased intracranial pressure, are they different activities that increase intraocular pressure? Same. So intraocular pressure, IOP, is the same as factors that will affect ICP. So intracranial pressure, intraocular pressure, same predisposing factors. Okay, same things that affect. Give me examples. What can cause increase in intracranial or intraocular pressure? What do you guys do that cause that pressure in your eyeball or your brain inside your skull to increase? When you're giving birth to a really huge turd, what will that do?
Pressure.
Okay, so therefore, what will be your interventions? Because do you want the patient giving birth to huge turds?
No.
No, so what will be your interventions?
C-section. No, stop.
You understand what I'm saying?
Yeah.
Okay, so stool softeners, what else?
C-section.
So fiber, high fiber, what else? Okay, increase water intake or ambulate, right? Yeah, fiber, things like that, right? Or stool softeners, for instance. What else? What activities will increase intraocular or intracranial pressure? If I bend down to pick up something or to tie my shoelaces. If I'm on my iPad all the time. Okay, because have you ever seen anybody play with an iPad upright like this? Seen people use an iPad like this? iPad's always down, right? So is that advisable to do?
No.
No, because that will put your head down, meaning that's equivalent to bending, correct? Okay, what else? Can they sneeze? They shouldn't. Okay, so what can you do to lessen the... Okay, so anti-allergy medications, antihistamines. What else? What other activities? Increase intraocular pressure. Sexual activity. Yeah, because any activity that involves pushing and pulling will increase intraocular pressure, correct? Have you, because what are you doing technically when you're pushing and pulling? Are you breathing?
No.
Can't breathe while you're pushing and pulling, correct?
No.
So you're holding your breath. Otherwise, can you pull while breathing? Can you pull? No, you have to hold your breath, right? So you have to inhale and hold your breath and pull or push, the same thing. So that will increase intraocular and intraocular pressure, intracranial and intraocular pressure. So here's your teaching post-op. Again, here you tell the patient what to do again. So can you stop yourself from rubbing your eyes when you're sleeping? So what's the protection there? You just had surgery on the eye. Okay, patient will be warned at night on the affected eye. And the eye shield, of course, will be taped, okay, so that you don't accidentally pull it out, yeah? Because can you pull out an eyeglass if it's just eyeglasses? Yeah, you can easily pull that off. Okay. So here are the post-op instructions. So pushing and pulling again, which will include sexual activity, correct? Because that's a lot of pushing and pulling. So the eye shield, washing hands, okay, you can't be contaminating. Here, when you apply the eye drop, what do you always give the patient? A tissue, and then you instruct them to wipe from where to where? What does this say? From the inner canthus outward. Okay, always start from the inner to out. Okay. So what is this statement saying? What are they trying to say? Do not get the operative eye wet. Okay, so be careful. And then avoid lying on the side that's affected. Here, keep your activities light. Again, avoid activities that cause you to push and pull, because again, any activity that will cause you to take in a deep breath and hold it increases intrathoracic pressure, and therefore it will increase intracranial and intraocular pressure. Right, I won't read the whole thing. Okay, you can read them for themselves. So what are the reportable? What do you tell them to report? Okay, here are the reportable. Now, take note that is there expected pain after the surgery? So do you report any pain? Do you report any pain? Does it say this? No, it says increased pain. Okay, so yeah, of course there's going to be pain. Somebody just mess with your eyeball. Okay, someone put a scalpel into your eye, remove the lens. So of course it will cause pain. But increasing pain, is that expected? No, that is strange. Okay, so yes, there's some mild to moderate pain. It should not be severe. Are we clear? Okay, so severe pain, is that reportable now?
Yeah.
Okay. So here, so these are reportable. Increased pain in the eye, changed in the, will there be drainage? Yeah, of course, because you had surgery. Okay, so there will be, what will be the drainage expected? What is normal drainage of the eye? What do you get in the morning when you wake up? What's in your eye? What's the color of that crust?
White.
Or
Yellow.
light yellow, right? So what if it's now orange or green? Okay, that's an infection. Is that reportable? Oh. Again, significant pain, especially those that are refractory pain, meaning pain doesn't respond to pain medications. Right, so this is, I'll grab, copy and paste as you like it. Okay, copy and paste these onto a select all and apply. Why do I keep asking select all and apply questions? And why does the NCLEX do the same?
Because it's not just one thing, it's a range of things.
Exactly. So these charts here, if you haven't figured it out already, charts and tables lay out what? Pretty much the plan of care, right? Yeah, it's here. One box tells you what is the plan for a certain topic, right? So it's nice, right? To keep all the information in one place. In that way, we can test you. Are you really competent? Do you know how to take care of a patient after eye surgery? Make sense? Okay. Any questions before I go next? Okay. So all the eye surgery, so if the patient has, let's say on the NCLEX, they mentioned another type of eye surgery, let's say scleral buckling, when we get to the retinal disorders later, like detachment and retinal tears. So that will involve surgery as well. Will the pre and post-op care be any different from cataract surgery?
No.
The same, okay? It'll be the same because it's the same trauma to the same eye that they did. Okay, so I'll go through this because again, the pre and post-op care will be the same, okay, for any eye, eye surgery. So two problems here, retinal detachment and retinal tears. So these are commonly used, caused by trauma to the eye. The trauma doesn't have to be penetrating trauma. It could be blunt. Blunt as in you hit your head hard enough on something. Especially if you're older, you hit your head, that can cause retinal detachment or tears. And for some people, do they immediately think about that? No. Okay, so they think, oh, I'm just, stupid, clumsy, I hit my head. And then they little do they know that they have eye or vision changes already, and they just think, oh, this part of getting old. Okay, so people have to be educated about these things. So let's say my father-in-law, so he had retinal detachment. He's now blind in one eye. So he had no idea when he sustained the injury. He did have the symptoms. Let's go to the symptoms here. Let's look at what really happens. So this is your eyeball. This part here that has the yellow, the yellow thing is think about the retina as a, when you get a new phone and there's a thin film over your phone screen when it's brand new, when you open the box. Okay, so think of the retina as that. So the retina is a delicate thin sheet, and it's attached to the back of your eyeball. So if this is your eyeball, toward the back, it's lined with the retina. The retina is supposed to be stuck to the wall of the eyeball, and it's connected to the optic nerve. So here is your optic nerve here. So this is supposed to be attached there. So there are millions of nerve endings there receiving light stimulus, and then they go to the optic nerve, and your brain interprets what you're seeing. So now I can see Felicia, I can see Faith, I see Brianna. Okay, so all the light that's reflecting onto the retina, because it's attached to the optic nerve, so that's how my brain interprets what I'm seeing. Okay, so what if it's detached now? Can you still see? Okay, so now can you go blind? Yes, so let's now go to the manifestation. So what will be manifestations of retinal detachment? Again, so there are many causes here. So patients can sustain this at any given process. Okay, so most likely trauma. Okay, any trauma of your head is hit or your face is hit just at the right moment, in a certain way. So let's say you get hit by a football, for instance, you're a pro player, so you can sustain retinal detachment injuries. Manifestations here. So this is what my father-in-law did, and then he just ignored it. So he's had bright flashing lights as well as this one. There were floaters. He said there were spots in front of his vision. Okay, he kept rubbing his eyes. He doesn't know what he's looking at. So those were microscopic pieces of blood floating in front of his retina. So there was bleeding inside. He had no idea what was happening. So these are the manifestations of retinal detachment. Now, if you haven't noticed, retinal detachment was actually one of the complications of cataract surgery. So surgery as well is also traumatic, correct? So it can also cause retinal detachment. So it's a complication, obviously. So here we are again, surgical management. Will our pre and post-op care be any different from cataract surgery? Exactly the same. So refer back to this pre and post-op care for cataract surgery. So here, this just describes what the various ways to repair retinal detachment are. A scleral buckle is literally this one. So this is a buckle. Now, remember, imagine the eyeball is inside your eye socket, correct? So this is now inside your skull. Now, just imagine, how did they get this silicone band around that eyeball? So use your imagination, okay? The amount of trauma they'll have to do in order for the surgeon to put this silicone band around there, right? So that's the part where I cannot stand looking at the procedure, but go right ahead, YouTube it, and watch for yourself. One thing not mentioned here is there is a right here, vitrectomy. Now, this procedure involves the injection of a dense gas or silicone oil. Again, dense gas bubble. Now, this gas, when we say dense, it's not really heavy. It's gas, so it'll still float. Okay, because what will gas do? Let's say when you fart, have you ever farted and the fart went down? Fart always goes up, right? Okay, so here this is a gas bubble. So the surgeon will inject this gas bubble, and it's dense though. So it's a gas bubble, so it will always rise, correct? However, it's dense. Dense as in it's packed with molecules. Okay, so it makes it extra heavy than room regular air. So if this is the tear, let me go back to this illustration here. So if the tear is right here, where do you think the surgeon will inject the gas bubble? The objective is for that gas bubble to go up and then press the retina back into place. Where will they inject it? Here or here? Okay, right here. So it depends really on where the tear is. So let's say the tear is over here. So this is my eye. So I have a retinal detachment on my left eyeball. The tear is here. It detached here. Okay, it detached this way. So the doctor will put the gas bubble in here. And because if it rises, then it will go up here. But the tear is here. So what do I need to do as the patient? I will have to do this so that the gas goes this way and it will press the retina back into place. So one specific difference here, if this is the procedure done by the doctor, is the patient must assume whatever prescribed head position the doctor says. Are we clear? It's not like they have to do this 24/7 because you have to rest, right? I mean, you get a crick in your neck, but most of the day, the patient must try their best to keep their head to whatever position the doctor prescribes. Is that clear? Okay, because otherwise the procedure will be worthless and they pay thousands of dollars for this procedure. All right. What's the procedure called? Vitrectomy. Okay. But again, all other eye surgeries will have the same pre and post-op care. Okay, last eye problems. Macular degeneration. There are two types here. We have dry macular degeneration and we have wet macular degeneration. Let's keep it simple. When we say degeneration, what's that pertaining to? Degeneration. So, yeah, the macula. So let's start with the macula. What is the macula? So this very center of your retina is the macula. So this is responsible for central vision. So you owe your central vision to the macula of the retina. When we say degeneration, what happened to the macula? So therefore, what age group is usually affected by dry? Okay, older. So this is just, you got old, okay? Wear and tear. Your eyeball, I mean, your macula is old. So it deteriorated, it degenerated. So this type of macular degeneration, which will cause central vision loss, and basically you're blind, it's age-related. Can you do anything about it? Can you stop aging? Okay, no. You can delay it. So the only treatment for dry AMD is vitamins, eye vitamins. So there are, the most popular brand is AirRed. That's made by Bausch & Lomb. You know Bausch & Lomb, right? They make contact lenses and eyeglasses. Okay. So they recommend eye vitamins. So that's a combination of A, carotene, beta carotene, E, etc. Okay, so just vitamins. Okay, so this will delay the degeneration, okay? Make your macula last longer. The second type is wet. This can occur at any age. This will affect any age, not just the old people. Now, this can have an abrupt onset. Of course, if it's chronic, like dry AMD, do you see the manifestations right away? If it's degenerative? No, slowly over years, right? We're talking years here. This one will be like this, okay? You were fine yesterday, now you're having vision loss, okay? So this one has a treatment, okay? So this is caused by abnormal blood vessels. So these blood vessels that grow supplying the eyeball are leaky, okay? These are defective blood vessels. You can compare it to cancer because cancer cells have that property. The cancer cells produce a enzyme that will cause your body to grow new blood vessels. The problem with these new blood vessels are they are abnormal. Okay, they are not like regular blood vessels. They're leaky. Okay, they're damaged blood vessels. So because they're abnormal blood vessels, so are they supplying the macula properly? No, they become leaky. And so the treatment here would be toward stopping the proliferation of these abnormal blood vessels. So that's right here. So since this is the cause, so therefore, what can you do to stop it? Stop these abnormal blood vessels from growing. So we have treatments like that. So we call those vascular endothelial growth factor inhibitors. Okay, so they're the same things we use to treat cancer. And here's another education on preventing eye trauma. So this would emphasize eye protection, the importance of wearing goggles when you're at work, for instance, working with heavy equipment or yard work, for instance. Hey, do you do that? No, right? You just get some grass into your eyeball, right? So you should be wearing eye protection. So here's I mentioned the vascular endothelial growth factor inhibitor. Okay, so this is now the treatment for wet AMD. Dry AMD, is there any treatment? Can you slow it down? With what? Yes, with what?
Artificial.
What did I just say? Okay, the eye vitamins. Okay. Any questions? Please also focus on it's part of the postdoc care. I forgot to emphasize that part on what are restricted activities. So let's say you just had eye surgery. Can you do crocheting or knitting or reading a book? Okay, so be specific, okay? The textbook gave specific examples. I'll use the same on the exam.
Okay.
That's about it for eyes. Any questions? Okay, let me just make sure. Yeah, we got it. Okay, let's go to ears now.